Hi everyone, I hope all of you doing great. Um this video is to discuss a case uh, where I have extracted all the teeth and placed implants, full mouth implant placement. Uh, why I wanted to discuss this case is because the patient was a known cardiac patient, and when the patient came to me and she said that she's a cardiac patient. I wanted to get the fitness from the cardiologist. Now, whenever cardiac patients come to our OPD, before we extract tooth, before we probably take up for a surgical procedure, or before we place implants, it's always better we get the fitness from the cardiologist. We cannot become cardiologists and say that you stop ecosprin, you stop aspirin, whichever the tablet is being taken by the patient, and decide how many days the patient has to stop this, and you perform the surgical procedure later. So this is my protocol, that I always send the patient to a cardiologist. Luckily we have a very good cardiologist in our town, whom upon whom I can blindly rely upon or depend upon when it comes to the cardiology. So I wanted to send the patient for fitness. Now, when I talk to the patient that you have to go to the cardiologist and get the fitness from the cardiologist so that I can proceed with the extraction, so that you don't have any issues when I am doing the procedure or after the procedure, let be anything. The patient was very adamant that she doesn't need any fitness because she has been absolutely fine for the past 4 to 5 years, though she is a known cardiac patient and she's been taking a lot of medication when it comes to the ailments. So I was very particular and I asked her to get the fitness. Now, till here it's fine. I mean, why am I making this video? Especially because most of you would be doing this. You would be sending for fitness when it comes to either blood sugar levels, or any other ailments that the patient comes to you with. Why I'm making this video is when I came into contact with my cardiologist, when I spoke to my cardiologist, um, my cardiologist said that the patient is on acetylone. This everyone needs to know. At least people who don't know about this, they should know about this now. That's why I'm making this video. When the patient is on acetylone, then what happens is, if I extract the tooth without considering few things, I mean, I should get the ECG done, I should get the echo done, I should get the prothrombin time done, I should get the INR done. All these have to be done before I usually take up for extractions. So this patient, prothrombin time was around 39.8. So when it was done, when my cardiologist took her for fitness, it was 39.8 and INR was 3.29. So when we talked, he said that acetylone has to be stopped 3 days before the surgical procedure or tooth extraction, and it has to be bridged with low molecular heparin, which is injectable form, and it has to be stopped 12 hours before the tooth extraction. So what my cardiologist is trying to do here is, he is stopping acetylone, and at once you can't stop acetylone also, because the patient has AF. And next thing is, he's bridging that with low molecular heparin, so that the supply is not cut off, and 12 hours before the tooth extraction he is going to stop. Now, when is he going to stop is his decision. I am not the one who decides that. So he would stop acetylone, he would bridge it with low molecular heparin by taking again prothrombin time and the INR. So he will again do PT, he will again do INR, and when it came to around 18.9 and 1.54 respectively, 18.9 was PT, from 39.8 it came down to 18.9, and INR from 3.29 it came down to 1.54. Then he was confident to send the patient to me for tooth extraction, that too stopping the low molecular heparin 12 hours before the tooth extraction. Okay, so this is a very important information for all the beginners, because this needs to be known. Many people, they just take the bleeding time, clotting time, or INR per se, and they tell the patient, you stop aspirin, you stop this, come after 2 days, we will extract. There is no need to worry. There are things to worry. We need to make sure that the patient doesn't have any problem on the chair and after the chair as well. Now, for on the chair, this has been the protocol, but after, subacute bacterial endocarditis is something which we need to keep in mind. So for that the patient has to be on antibiotic prophylaxis. So my cardiologist told me to start with oral amoxicillin 3 grams 1 hour before the procedure and 1.5 grams 6 hours after the procedure. This is the prophylaxis that my cardiologist told me to put the patient on. In case the patient cannot take 3 grams orally, then he also gave me an option of injectable ampicillin 2 grams 30 minutes before and 1 gram 6 hours after. So this is the prophylaxis that everyone needs to follow when it is a minor surgical procedure like a tooth extraction or a periodontal flap curettage or something like that. Okay, in case the patient is allergic to penicillin, let's say the patient cannot be given penicillin either orally or when it comes to IV, then you can give oral erythromycin instead of amoxicillin 1 gram 2 hours before the procedure and 500 grams 6 hours after the procedure. This is the protocol for people who cannot take oral amoxicillin because they are allergic to penicillin. IV, when it comes to IV, instead of the ampicillin, in case the patient is allergic to penicillin, the patient can take clindamycin 300 grams 1 hour before the procedure and 150 milligrams 6 hours after the procedure. This is for IV or IM per se. So these things please keep in mind. If you want, you can just go through the video again and again, make notes of it, and also consult your cardiologist before you do all these things. This is very important. A cardiologist plays a very, very big role if a cardiac patient comes to you, or if you have any doubt that I need to take a fitness from a cardiologist when it comes to any surgical procedure, right from extraction of a mobile tooth to any major surgical procedure in your dental OPD. Okay, and always write it down as fitness. It is not consent, it is fitness that we need to ask for when it comes to any cardiologist or diabetologist, whatever, whomever you send the patient to. I hope this helps. Cheers.